Good afternoon, everyone. I know you're enjoying company at your tables, but I want to get us started with this incredible award ceremony. I'm Larry Jameson, the Dean of the School of Medicine. I'm delighted to see all of you here today. You might have wondered what's going on behind us. What's been all the activity with the pavilion? There's a big celebration out there today with the American flag, and there's a beam that we signed about 2 weeks ago. We had the Board of Trustees and medical students and nurses and doctors sign the beam because today is the topping off ceremony. It happened at noon, and you might have seen the crane rising it up. There's a similar beam in this building that was put up 5 years ago. We signed it over on the other side of the garden there, and then it was raised. And these are important symbolic events that happened. Now, last night in this very room, we had an incredible scholarship reception for our scholarship recipients and the donors. Today we get to recognize some of our distinguished alumni. We have so many distinguished alumni, it's a real challenge to highlight a few, but I'm happy to do that. And this morning, we had the 50th year class have an incredible panel talking about their years in medicine, what's transpired, how much change has occurred. And I just wanted to note that Dr. Dranoff had a slide that showed his edition of the Harrison's Principles of Internal Medicine book. He showed the 11th edition. I just wanted to remind him in the 50-year class that some others have come out since the 11th edition. Here's the 20th edition. A few things have changed. In the 20th edition, it's now color photographs, some great figures. Now his point, which I think is really quite interesting, is for all the text in the internal medicine book, it pales in comparison to the regulatory text that governs the practice of medicine. We're trying to keep that in balance. So Dr. Schwartz, you're going to help work on that. So let me just describe a little bit more about this process. We have 3 different awards. We have a Young Alumnus Award, Distinguished Service Award, and Distinguished Faculty Award. And I'm going to begin with the Young Alumnus Award. This is based on, obviously, someone who's shown incredible leadership. And this year's recipient is Dan Hashimoto. He earned his MD and master's degree in translational research at the Perelman School of Medicine, and he's been focused on technology and surgical education. His research interests lie at the intersection of technology, surgery, and teaching. Right now, he's in a surgical residency program at Mass General Hospital, and he's also spending time at the Massachusetts Institute of Technology, MIT, trying to combine those skills in the practice of medicine. He's been developing a curriculum that uses virtual and augmented reality to teach surgical skills. He's examining how surgeons can utilize wearable technology in the operating room, and is part of a collaboration to design and develop computer visualization systems for laparoscopic surgeries. And this will help provide clinicians with real-time intraoperative probabilities and estimates of complications. He's currently the Surgical Artificial Intelligence and Innovation Fellow at MGH and co-founded the MGH Surgical Artificial Intelligence and Innovation Laboratory. Now, I know Dan because he holds leadership in a variety of organizations outside of his residency. He's on the board of directors of the Association of American Medical Colleges, better known as the AAMC, and he and I served together on the search committee that found the current and incoming president and CEO of the AAMC, Dr. Scorton. He also serves on the board of governors of the Society of American Gastrointestinal and Endoscopic Surgeons. The acronym is SAGES. And he's an active volunteer in the Penn medicine community, a member of the Council of Recent Graduates, and he's been serving on the 5th year reunion committee. Dan, for your dedication to Penn medicine and enhancing surgical practice to the benefits of patients everywhere, I'm honored to present you with the Young Alumni Service Award.
Thank you very much, Dean Jameson, and thank you to the University of Pennsylvania and everybody through the Alumni Development Relations Office. For me, this is an incredible honor, and it's been really a blessing to be a part of the Penn family. My Penn education has prepared me not just for residency, but to really interact with great leaders like Dean Jameson at the AAMC and other organizations. And it's something that I couldn't do without the support of the mentors I've made here, even those that leave the OR to come to this lunch. Thank you, Dr. Dumont. And then the friends and colleagues that I've made along the way, my classmates, some of who are here, and of course my wife and my parents, my siblings who've been incredibly supportive. So thank you, everybody. Thank you so much.
Okay, well, we're all going to keep our eyes on your work, Dan. It's incredibly innovative and field-changing. We wish you all the best. The Alumni Service Award honors recipients' generous, loyal, and energetic commitment to the School of Medicine and to our development and alumni relations programs. Honorees are selected annually by the nominating committee of the Medical Alumni Advisory Council. We sometimes refer to this as MAC. The first Alumni Service Award recipient is Barry Gertz. Barry earned his bachelor's degree in chemistry from Penn and an MD PhD from the Perelman School of Medicine and was a resident here at Penn. He was subsequently a fellow and then on the faculty at UCSF in the field of endocrinology. After publishing a large number of scientific papers, and he's had a gamut of experiences in drug development, from exploratory clinical pharmacology to global phase 3 clinical trials. He joined Merck as an associate director, becoming senior vice president and head of global clinical development, and he was instrumental in the development and approval of more than 25 new drugs and vaccines. Very impressive. He's currently the managing director in the Blackstone Life Sciences Group. He's remained very active in the Penn medicine community. He's funded and been an active participant in our wilderness and disaster medicine education program. Some of you heard Peter present that to the MAC group yesterday. And he served on the Medical Alumni Advisory Council since 2008. He's a valued member of our board of trustees. We need to give him an office here at Penn for all of these different contacts. Barry, we're proud of your leadership, extremely grateful for your commitment and service to the Penn medicine community. Congratulations on this honor.
Well, thank you, Dean Jameson and the Development Office and all of those from the university and the Perelman School of Medicine. It's been immensely gratifying for me, and for my wife Laura, who's here today, to be able to support the Penn community, particularly the School of Medicine. I had so many excellent opportunities to learn here. I was here for more than a decade, and my teachers and my colleagues, my peers, were the ones that really prepared me for what I thought has been so far a very exciting life outside of the university. But most of all, the greatest satisfaction has been from hearing from the students. And I hear from the students who take the wilderness medicine course that Dr. Sonneman runs, and they just love it. And I get letters every year from the MD PhD students who go to the various conferences by virtue of the travel fund that's now available to them. And it means so much for them to get out and present their work to scientists across the country, and to realize that when they're here for 7, 8 years, there is an end in sight, and they're gonna have a great career themselves. So It's been just phenomenal, and I want to thank everybody here, and thank you, Dean Jameson.
So the second recipient of the Alumni Service Award is Dr. Arlene Bennett. She's a native Philadelphian and a proud graduate of Girls High. She served in the U.S. Air Force between 1953 and 1956. She used the GI Bill to earn a bachelor's degree in education in 1960 at Penn. She's the first African-American woman to earn an MD degree from this school of medicine. That's something that we definitely want to recognize. Before this lunch, she was describing going into the operating room with C. Everett Koop over at CHOP. Although she remembered in great detail what happened with those cases, instead of becoming a surgeon, she decided to become a pediatrician and was a pediatrician for 10 years. She published an article in Freedom Ways, the leading African-American theoretical, political, and cultural journal of the time. But ultimately, she was drawn to the field of psychiatry and undertook a residency at the Eastern Pennsylvania Psychiatric Institute and has been in solo private practice and worked part-time at community mental health here in Philadelphia. She still practices and remains active in the community, supervising psychiatric residents and psychology interns, and serving as a mentor to students here at the medical school. She served on our MAC committee since 2010. She's a member of the class of 1964 reunion committee, which this year is celebrating their 55th reunion. And 5 years ago, we had you here for the 50-year class when you spoke at graduation. She's received the 2014 Women in Medicine Award and was inducted this year into the AOA Honor Society. Arlene, your dedication to Penn Medicine and the surrounding Philadelphia community is making it a happier and healthier place. I'm honored to present you with the Alumni Service Award.
I'd like to say thank you to Dean Jameson, thank you to the faculty, also to my teachers who are no longer here, but they're here in my heart and in my practice, my classmates, and my other fellow Pennsylvanians, Perelman Medical School people. One of the most important things that I want to leave with you is that there's a lot of research, a lot of discovery that goes on here, a lot of teaching. Those of us who are doing clinical work need you to continue to do this. This is very important to us. It's very important to us in terms of directly helping our patients. And one of the things that is so important to me, we were taught to look at all areas, to be very thorough. And I'm happy to say, at this age, I can still find exotic diagnoses, and I still adhere to our thorough evaluations that we were taught to do. This is a fantastic place. I would not have gone anyplace else. Thank you.
Arlene, those are inspiring words, and we're going to follow your orders. We'll stay with it. She was also describing to me making the diagnosis of porphyria in a patient. There are not many psychiatrists who do that, so you walk the walk. So now I want to turn to the Distinguished Graduate Awards. Established in 1982, these awards honor highly accomplished alumni for their outstanding service to society and to the profession of medicine. They have notable accomplishments, either in biomedical research, clinical practice, or medical education. They have achievements that have resulted in national or international recognition. Honorees are selected by a panel that includes Penn Medicine physicians and previous award recipients. I see several of you looking in the materials, and I encourage you to do that because we couldn't possibly capture everything that these individuals have accomplished, and even these summaries are, of course, executive summaries. This year we have 2 distinguished graduate award recipients. Our first is Rajiv Raj Shah. He received his undergraduate degree at the University of Michigan in Ann Arbor and his MD in 2002 and a master's from Wharton in 2005. Raj then worked with the Bill and Melinda Gates Foundation as one of the early staff, where he helped launch 3 major initiatives: the Alliance for a Green Revolution in Africa, International Financing Facility for Immunization, and a Global Development Program. The first was a joint venture by the Gates and Rockefeller Foundations, maybe foreshadowing your future. The second raised money, more than $5 billion, for childhood immunizations worldwide. And the third was a foundation that focused on developing countries with focus on family health, vaccine delivery, emergency relief, and access to computers and the internet. In 2009, he was appointed to the U.S. Agency for International Development, better known as USAID, and was appointed in that role by President Obama. He secured bipartisan support for USAID's work to address extreme poverty, again through 3 main programs: Feed the Future, Power Africa, and Global Food Security Act. The Feed the Future was launched in 2010 to address the root causes of global hunger and food insecurity. Power Africa aims to bring 30,000 megawatts of cleaner, more efficient electricity generation and capacity and 60 million new home and business connections in sub-Saharan Africa. And the Global Food Security Act requires the president to develop and implement a strategy to promote global food security, resilience, and nutrition. He then founded Latitude Capital, a private equity firm focused on power and infrastructure projects in Africa and Asia. And this continued his passion for creating opportunities for communities to thrive in the developing world. He's currently president of the Rockefeller Foundation. He brings over 20 years of experience in business, government, and philanthropy to support its mission to promote the well-being of humanity throughout the world. By focusing on community health to make health for all a reality, promoting science and engineering for the public interest, and forming innovative public-private partnerships to bring electricity to 1.3 billion people without it. Raj, your contributions are providing life-saving access to food, health, and water for millions of children across the planet, truly making the world a better place. Congratulations on being named a Distinguished Graduate Award recipient.
Thank you, Dean Jameson. That's very kind and very thorough, so I appreciate it. And I do wish my mom was here to hear that. My wife, Shivam, is here to hear that, and I owe any success we've had together to the energy we've, to our efforts together over a career and a lifetime, and we moved into 2400 Chestnut Street, I guess that's what the 2400 is, just the day before medical school orientation started, so it's fun to be in this sparkling new building looking out at that wonderful place across the Schuylkill. I will say, on a personal basis, it's an extraordinary honor to be here with you and to be here on a day when Sankey and Sandy are both here as well. Dr. Williams was the chair of medicine and someone I looked up to and still do. And Sandy Schwartz, who we will hear about next, I'm sure will say all the great things about his career, but the thing that I keep thinking about is as a mentor and a friend, he was someone who said that you could really aspire to do whatever you wanted to do, and you were in medicine or business or economics, but the world was your oyster here at Penn when you had folks like Sankey and Sandy standing with you. So being here with both of you is particularly special, and thank you very much for being here. I love this institution. I remember the days when Shivam would wonder why I was walking around with my Netter anatomy book and why it was a little dirty and smelled bad. And she's like, shouldn't you be keeping that in the cadaver lab, or do you really need to walk around with it all the time? But, you know, that was medical school, I guess, at the beginning. I particularly remember a program that we had in the school called Students Teaching Aids to Students, where first and second year medical students would go from here to West Philly and talk to kids in 6th and 7th grade in local schools. And, you know, the kids in particular would send their questions in on these 3x5 cards. And I still remember some of to protect their privacy. And I remember realizing in that moment that these girls in West Philadelphia in 6th grade were living in a very difficult environment, and too many were subject to violence and sexual abuse and had questions that no 6th grade girl should have to ask a local medical student just trying to help. And I guess that taught me that folks who want to heal and help others need to learn the art and the practice of medicine, and also need to have a heart and an empathy for the communities in which we work and in which we live. It's also special to me, now that I mentioned that Dr. Mukwege, Dennis Mukwege, is here. Dr. Mukwege and I have had the chance to work together for a couple of decades now, or at least 10, 15 years, and he has saved so many lives in the eastern part of the Democratic Republic of Congo, bringing that same commitment and that same mindset. So thank you to Penn Medicine, thank you to the community of faculty and students that have always had an aspiration to make a mark and a positive difference in the world, and thank you for this very special recognition. Thank you.
Well, Raj, it's really, really impressive to think about the impact you've had on the world. And Dr. Mukwege, who you recognize, is going to receive an honorary degree from Penn on Monday at graduation. And it's really a privilege to have you join us here. I mean, arguably, Penn Medicine does so many things incredibly well, from early stage translational research, outstanding advanced clinical care, the education of our students and residents and fellows and one another. But the work that we've just heard about in healthcare policy and implementation is another area where we lead, which also brings me to our next Distinguished Graduate Award recipient, Jay Sanford, better known as Sandy Schwartz. Sandy earned his medical degree in 1974 and completed residency here in 1977. And together with Dr. Williams and John Eisenberg and others, they really helped to found the field of health services research, innovation in healthcare delivery, and a sharp focus on healthcare policy as it applies to our field of medicine. His contributions in medical decision-making, innovation and assessment interventions and practices have now spanned 3 decades, impacting policy and practice around the globe. He's the founding director of the medical profession's first evidence-based clinical guideline program, the ACP's Clinical Efficacy Assessment Project. He's been a leader in multiple organizations, the president of the AFMR, the American Federation for Medical Research, that was in 1991. He's also served as president of the Society for Medical Decision-Making. This group is focused on improving health outcomes through the advancement of proactive, systematic approaches to clinical decision-making and policy formation in healthcare. And he served as the presidential appointee to the U.S. Preventive Services Task Force. This group provides evidence-based recommendations for clinical practice, and it serves as a national expert in disease prevention and in medicine. He was the founding editor-in-chief of the American Journal of Managed Care, an independent, peer-reviewed monthly publication. In the brochure, there are a lot of other roles. He's been elected to the National Academy of Medicine, where he's currently serving in a leadership and governance role. He's the Leon Hess Professor of Medicine at the Perelman School of Medicine and Professor of Healthcare Management at the Wharton School. He served here as Executive Director of the Leonard Davis Institute for 10 years, and he still is a Senior Fellow in that group. He served as Co-Director of Penn's Robert Wood Johnson Clinical Scholars Program, and he's received numerous teaching awards, including the Limback Award for Distinguished Teaching. Congratulations, Sandy, on being recognized as an exceptional member of our family and for your impact on our field and students.
I want to thank Larry for lots of things, tremendous support for all of us and the faculty and all of us doing work. I also want to thank him for the tie. Though, so you know, I don't think Larry even knew I owned a sport jacket. Now I can't tell him that. But I was not yet complete till I had the tie today, which will only last me one meal. But I want to thank Larry, and I want to thank the committee and everybody here. You know, when you hear yourself described some way that people who know you just would not recognize, it reminds me of once when family met me at 30th Street Station, and somebody I had met on the train who was a policymaker in Washington. We had come up from Washington, met the kids and said to one of them, you know, I was talking to your dad on the train, he does some very interesting things. And I think it was Adam who looked directly at him and said, not at home he doesn't. So I think that's a more accurate. But I'm very pleased and grateful to have received this honor. It's especially meaningful. Barry and I worked together many times on the medical service in the ICU. And Raj is like a family member. It's all the things you do as a faculty member when you're engaged in research and clinical work are all enormously rewarding, and you're learning all the time. It's really the students and the trainees that are why we're all here. And that's what it's all about, is identifying, which isn't very hard at Penn, people who are smarter and better than you, and helping remove barriers to them and help them facilitate what are going to be very successful careers. Now, George Bernard Shaw once said, it's dangerous to be sincere unless you're also stupid. So let me just take 1 or 2 minutes because I've been at Penn my whole career. And to the degree that anything I've done, it's really a tribute to Penn, because I came here in 1970 and I was a student of the 60s. A bunch of my classmates, George and Mark and others, are here. And, you know, we were smart and we were full of unbridled enthusiasm, and we wanted to, you know, change the world and make it a better place. But we were like puppies. We didn't know where we were going or what we were doing. And Penn gave us the freedom and the structure and the rigor to let us develop in who we were. I still remember as a medical student, first-year medical student, everybody had, as part of an innovative new curriculum, which is actually what attracted me to Penn, had an afternoon a week or 2 afternoons a month that you had an opportunity to work with people in a lab and you were interested. And I was never going to be a basic scientist, and I had the opportunity to be with Renee Fox, who's one of the world's great medical sociologists, and Bill Kissick in health policy. And there wasn't another medical school in the country that would have taken that. This is in 1970. There was no health services research. There was no health policy research. And to allow us to take advantage of the whole university and all that it has to offer was just, in retrospect, just an unbelievable gift. The other thing that I'm very appreciative about is the support that I have today from Judith Long, who's my division chief, and Mike Parmachek, and Larry, and have had through the whole time through several different deans and chairs and a couple division chiefs, Sankey being one of them. Because They took a chance on people like me, and we still take chances on people like me. There was no career path when I started. There was no field. There were just people who had questions, and we were encouraged to ask good questions. And just the other day, I think it was Wednesday, Larry spoke to the national site visit for the National Advisory Board for the Clinical Scholars, and he pointed out that the people who are trained today, he doesn't know what that career path is, but he knows that we need it, and the school is here to help support and develop that. Last two things I just want to say are, there are three people who had an enormous impact on my career, and they were Sam Martin, who really brought health service and policy research we now call to Penn. And then two young people who knew barely more than I did at the time, Sankey Williams and John Eisenberg, who really introduced me to this field. And Sankey has been my friend and colleague and mentor for really, God, I don't know, almost 40 years. And I can't imagine having done anything that I've done without him. And lastly, my family. Family and friends are terrific. They love you even though they know you. And with all your flaws and all your warts, and as we all know, it's our family and our friends who are the ones who really tell us the things we need to know and give us the guidance we need to have. So again, I want to thank you all. When I turned 50, people would meet you on the street and say, "How's your day going?" And I'd started saying, "Well, I woke up, so it's a good day. Now we'll just see how the rest of the day goes." And I just want to tell you, this is a great day. Thank you.
Well, congratulations to all of our recipients. I want to thank the selection committees, and I also want to thank all of you for coming out today to celebrate these important accomplishments. At Penn, we have a Penn Compact, and there are three main pillars: inclusion, innovation, and impact. And I think you see in these award recipients how strong those pillars are. When Dean Rose and I think about the characteristics of the students we want to be here and the environment we want to create here, I think all you have to do is look at these award recipients and at many of our alums who are here, and that defines what we're looking for. People who will be inclusive, innovative, and have an impact on their patients and the world. So thanks so much for coming out. Please enjoy your company around the table. We've got lots of other exciting events in the course of the weekend.